Almost 30 years ago, I was diagnosed with type 1 diabetes. Luckily, somebody had referred me to the Joslin Diabetes Center, and I met a doctor who is still my endocrinologist there, and he started our first meeting by saying his job was to give me as many tools as possible to manage my illness, but it was really my disease, and it was my decision whether or not I wanted to be in control of my illness. And I just thought that was an absolutely wonderful thing for a doctor to give me. For many years, the diabetes was the only thing that I really had to worry about, but probably maybe 10 or 15 years ago, I found out I had a thyroid issue, which may or may not be related to diabetes, so I have Hashimoto's disease. And then about 3 years ago, was diagnosed with something called hypercomplementaric urticarial vasculitis. Sometimes it's really hard to manage everything with all my health issues. I think the most important thing is just access to information about whether it's a diagnosis or specific tests or what the results are or what my options are going to be. About 5 years ago, I started getting access to notes from my primary care physician, and that really opened up, I think, just a whole new world for me as far as looking at my care and really understanding it. I absolutely believe that having OpenNotes and having access to all my information has changed my relationship with all my providers in a very positive way. It's definitely made me more open to talking with providers and following up with things that I'm not quite sure about that. I don't think I would have done had it not been for having the ability to gain access to the notes and other information that's in my health record. I just thought I should mention it to you.
I think at the end it's useful for the overall management of several conditions and definitely improves communication.
I feel like I can trust what the providers are saying, telling me, but that also my providers really trust and listen to what I'm saying. Even though I have a variety of health issues, I still feel like I'm a very healthy person. But I think part of that is because I feel like I own all these health issues. It's just a matter of having more information, more tools, and just owning my health care, owning my illnesses, but more importantly, owning the treatment or the management of the disease.